Good morning, everyone. 8:23 on your Tuesday morning. It's estimated 1 in 4 Canadians gets a cold sore each year, and these sores can have a major impact on one's quality of life. But Dr. Martin Unger, Clera's consulting physician, is here now with a new treatment option for these nasty cold sores. Good morning to you.
Good morning, Leah. Thank you for having me.
Absolutely. So let's start off, first of all, how common are cold sores? They seem incredibly pervasive.
Well, first of all, 80 to 90% of our population is infected with the virus that causes them, the HSV1 virus.
Right.
And as you just related, in the Myra Matchbox study, they showed that 9 million Canadians do suffer from at least one cold sore a year, and very often it's as many as 3 or 4 a year. And the social ramifications of that is very important, because when they do have a cold sore, it's been shown that 51% of people either cancel or rebook their social engagement, and as many as a third of the people actually call in sick to work. So, that affects our labor force.
Huge quality of life issues here.
Yeah. Yes, and our own self-confidence, our own well-being.
Absolutely.
So it's extremely important.
Absolutely. Now, what can we currently do for people who get cold sores?
Well, there's 1,000,001 ramifications that can be used, but the question is, what is the best use? And quite honestly, a new product on the market, Clera, has just been approved a few months ago, and it is far superior to any of the products currently on the market.
And why is that?
Well, it's the first product that we can actually say it kills the HSV virus, the virus responsible for the cold sore, whereas all the other products on the market today, the over-the-counter market products, they only keep the virus
symptoms under control?
In control, yes.
Yeah.
They keep them there, but they don't kill them.
Right.
And that has very important ramifications. As you probably know, there's a prodromal phase. So before you get a cold sore, most people will get a little tingling or
Yes.
a little itch.
Yeah.
And if you put just a little drop on the area and keep it moist, reapplying it as you need to, then studies have shown that up to 70% of people won't even get a cold sore.
Really? So it won't even progress?
That's right.
And that's because you're killing that virus off?
Correct.
Okay.
And if they do get a cold sore, it'll be much smaller and heal much faster.
Oh, that's wonderful news.
And if you miss the prodromal phase, of course, and get into the blister or vesicle phase, then it's going to accelerate healing tremendously. And in many cases, healing will occur as soon as 2 days. And no other product on the market can make that claim.
Wow, 2 days? Because sometimes it can take up to 2 weeks, can't it?
Normally 10 to 14 days is
Sure.
the normal healing time.
Sure. Wow.
The other beautiful thing about Clera is it doesn't cause any viral mutation. It doesn't change the virus or make it more dangerous to our society. Repeated use of Clera will decrease the number of recurrences, the number of times you get it each year, in each year's. And last but not least, it's totally safe. No
side effects.
Side effects or anything, unless you happen to be allergic to stannous,
Of
which is the active ingredient. And I've never seen an allergy to stannous, but it might be possible.
So this is a nice treatment option for a lot of people who suffer.
Fabulous. We're extremely pleased and extremely excited about it, that now our Canadian population has this option, and also the fact that it's over the counter. You don't
Right,
need
so
a
you can just pick it up at your local pharmacy.
That's right.
Terrific. Dr. Unger, thank you so much for telling us all about this.
You're very welcome. My pleasure to be here.